Hi friends, welcome to my YouTube channel Future Midwife. I hope you all are fine. For the past 1 month, I couldn't take any classes for you because I was in annual leave. So in the YouTube classes, still we are in the track of antenatal care. So last class I have taken a minor ailments of pregnancy. So this class we will continue with the antenatal care. Antenatal care is a systemic supervision of a woman during pregnancy. So this antenatal care is very important throughout the pregnancy. So once we are giving a proper care to the mother, then only we can get a healthy baby from the healthy mother. So each care given to mother is directly or indirectly affect the growing fetus. So ultimately we get a healthy baby from a healthy mother. The main objective of antenatal care is to ensure a normal pregnancy with a delivery of healthy baby from a healthy mother. So next we'll see the aims of antenatal care. The first aim is to screen the high risk cases. Second one, to prevent or detect and treat at the earliest any complications. Third one, to ensure continued risk assessment and to provide ongoing primary preventive health care. The fourth one is to educate the mother about the physiology of pregnancy and labor by demonstration charts and diagram so that fear is removed and psychology is improved. The fifth one is to discuss the couple about the place, time and mode of delivery professionally and care of the newborn. The last one is sixth one, to motivate the couple about the need of family planning and also appropriate advice to couple seeking medical termination of pregnancy. Antenatal care comprises of 5 things. First one, registration of pregnancy. Second one, history taking. Third one is antenatal examination. Fourth one is laboratory investigation, and finally the last one is health education. If the woman experiences any mixed periods, the first thing is to confirm her pregnancy. For that, she has to go to any obstetrician or obstetrical nurse to confirm the pregnancy. So once she confirms the pregnancy by urine test and blood test, next is registration of pregnancy. After that, she has to go for history collection, examination and investigation. The history collection include particulars of patient, chief complaints with duration, past history, obstetrical history, menstrual history, family history, drug history, history of immunization, socio-economic history, contraceptive history and history of any allergy. Next we'll move on to the antenatal visit and its duration. So ideally up to 28 weeks once in a month, up to 36 weeks twice in a month, thereafter every weekly till the labor. Minimum there are 4 visits required. The first visit at 16 weeks, the second visit between 24 to 28 weeks, the third visit at 32 weeks, and the last visit, that means the fourth visit at 36 weeks. During physical examination, the obstetrical nurse has to check the pulse, then respiration, then she has to check any edema in the legs, then she has to go for blood pressure monitoring, then the weight monitoring is also very important, and she has to check for any pallor in case of anemic sign, and she can go for breast examination also. These are the physical examination the obstetrical nurse need to check during each visit. During physical examination, obstetrical nurse has to check the pallor. So it is very important to rule out the anemia. So in this case, she has to check the conjunctiva, nail buds, oral mucosa and tongue. So if there is any pallor which indicate the anemic symptoms. Next she has to check the pulse. So pulse should be in between 60 to 90 per minute. The normal respiratory rate is 18 to 20 breaths per minute. So later she has to check the edema. So especially there is edema in the lower extremity indicate preeclampsia or eclampsia signs. It is very important to check the BP in each antenatal visit. So here in BP, 2 consecutive reading has to be considered. In this 2 consecutive reading, systolic blood pressure more than 140 mmHg or diastolic more than 90 mmHg is considered as risk. Check urine for the presence of albumin. In case of preeclampsia, there are hypertension along with albuminuria. Imminent eclampsia, there is diastolic blood pressure more than 110 mmHg. In case of eclampsia, hypertension, albuminuria, and along with there is convulsion also. In each antenatal visit, regular monitoring of weight is very important. So around 11 kg will be increased throughout the pregnancy till the term. So after first trimester, 2 kg weight in every month there is increase. Then next is breast examination. That is also very important. So during breast examination, the obstetrical nurse can identify the breast enlargement and presence of primary areola, secondary areola, and Montgomery's tubercles. These all changes has to be evaluated in every antenatal visit. Abdominal examination also very important in each visit. So which comprises of measurement of fundal height, fetal heart sound, fetal movements, fetal parts identification, multiple pregnancy, fetal lie and presentation, inspection of abdominal scar or any other relevant findings. So these all things has to be identified during each antenatal examination. After physical examination, next one is lab investigation, which include HB estimation, blood grouping and RH typing, urine routine culture, etc., VDRL, RBS, HBsAg test, USG for pregnancy profile. There are some risk approach which has to be keep in mind when the obstetrical nurse screening the woman. The first one is elderly primary, that means age 30 and above. The second one is short-statured primary, that means the height of the woman is less than 140 centimeter. So next is malpresentation. So this malpresentation has to be screened properly. Other than that, APH, threatened abortion, preeclampsia and eclampsia all are in the risk approach. Besides that, there are few more risk approaches. The first one is anemia, teen pregnancy, hydramnias, IUFTs, stillbirth, elderly grand multiparas, prolonged pregnancy, history of past cesarean or instrumental delivery, and treatment for infertility. In subsequent visit, the obstetrical nurse has to check the patient complaints, then general examinations, gestational age to be calculated, identification of problems, fetal movement has to be checked in all antenatal visit, SFH measurements, health education, prophylaxis and treatment of anemia, developing individualized birth plan. These all things has to be keep in mind once the obstetrician need to take care of the mother during antenatal visit. In second visit, that means 24 to 28 weeks, in this visit it is very important to measure the SFH, then to detect multiple pregnancy. In the third visit, that is at 32 weeks, here we have to go for screen for preeclampsia, multiple pregnancy, anemia and IUGR. In the fourth visit, that means in 36 weeks, here we need to do the identification of fetal, lie, presentation, position and birth plan. Antenatal dietary advice is very important. A pregnant woman has to take 300 kilocalorie per day. So once it comes to the lactation, it has to be the double, that means 600 kilocalorie per day. So this diet include balanced diet, that means protein, carbohydrate, vitamins, minerals, all those things has to be taken in the balanced way. The balanced diet includes sufficient amount of water intake. She has to take 2 to 3 liters of water per day, which helps for her hydration as well as prevent urinary tract infection. Now I will show the DD of woman during second half of pregnancy. The kilocalories should be 2500, protein 60 gram, iron 40 mg, folic acid has to be 400 μg, calcium should be 1000 mg, vitamin A 6000 international unit. Iron supplementation also very important in the pregnancy period. So it has to be start when the woman become 28 weeks of gestation. In the 28 weeks of gestation onwards, she has to take ferrous sulfate tablet. Usually that is 30 mg per day. So if the mother is overweight and there is teen pregnancy, she has to take 60 to 100 mg per day. In case of anemia, 200 mg per day iron she need to take. So hygiene throughout pregnancy is very important. The pregnant woman has to take bath daily, so which gives relaxation and refreshment to the pregnant woman. So avoid hot bath during pregnancy. Bowel care also very important during pregnancy. There is a chance to get the constipation throughout pregnancy, which need to be corrected by means of taking proper intake of water and diet correction. Breast care also very important throughout the pregnancy. There is many breast changes can be happen throughout the pregnancy, so she has to clean the breast every day with soap and water. Exercise also an inevitable content in antenatal care. So she can do moderate walking, avoid heavy weight lifting. So she has to be avoid long standing and long sitting. While sitting, crossing over the leg should be avoided. If there is any presence of edema in the extremity while sleeping, she can keep one pillow under the leg, and while sitting the leg has to be keep elevated. Clothing also very important during pregnancy. She has to wear a comfortable dress. Comfortable dress means it should be loose and comfortable. She can wear a cotton dress throughout the pregnancy, which will be preferable. And tight belt and tight clothing should be avoided. Alcohol consumption, smoking and harmful drug consumption should be avoided throughout pregnancy. The pregnant woman has to take sufficient rest. She has to avoid strenuous work, and also 8 hours sleep is recommended, and 2 hours sleep in the daytime has also recommended. Then coitus should be avoided in the first trimester and in the last 6 weeks also. Family caring and support is very important throughout pregnancy. Family behavior and attitude should be pleasant and encouraging. Family should ensure provision of healthy diet and timely visit to health facility. Avoid delay in contacting medical facility when labor start or in case of a complication. Adequate finance and transport should be arranged beforehand. A blood donor should be identified for any unforeseen and emergencies. Care and support by husband and mother-in-law gives emotional support and confidence in childbearing. There are some warning signs which need to be reminded while antenatal visit. The obstetrical nurse or obstetrician has to teach the warning sign to the pregnant woman. The warning signs are blurring of vision, headache, vaginal bleeding, fever and convulsions. If there is any signs of these all things should be monitored immediately and should be notified by physician, and the pregnant woman has to go to the hospital and immediately seek the medical advice. Here we can wind up our today's topic. I hope I have completed most of the antenatal care and advice. So next class we will meet with another antenatal topic. So till that, take care. Bye bye.